Snoring isn't always just a sleep habit. In many cases, it can be a sign of obstructive sleep apnea, a condition where your breathing repeatedly stops and starts while you sleep. Watch out for these warning signs: loud, frequent snoring, gasping or choking during sleep, waking up feeling tired, morning headaches, excessive daytime sleepiness. When your airway becomes blocked during sleep, your body doesn't get enough oxygen, which can affect your heart, brain, and overall health over time. The good news: snoring and sleep apnea are treatable. An ENT specialist can evaluate your airway and recommend the most appropriate treatment to help you breathe and sleep better.